Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Good Wednesday afternoon to you. It's Wellness Wednesday. DHEC, In It Together, SC, and the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday right here on Coping with COVID. And today we're going to talk about the 19th Annual Chronic Disease Symposium. Khristian Curry with DHEC is going to join us to tell us about this amazing conference coming up in June. Khristian, thank you so much for joining us today.
Thank you for having me, Tre.
Absolutely. And we're also going to be joined by one of the keynote speakers. Dr. Damon Tweety is the book of Black Man in a White Coat. It's a doctor's reflection on race and medicine. He's going to talk to us about the facts and the myths in the healthcare system and what you can do to navigate through them safely. Dr. Tweety, thank you so much. We're looking forward to this great conversation.
Likewise, looking forward to it.
Thank you so much. That and more coming up next on Coping with COVID. But first, your COVID community updates. You've got even more time to register for health insurance due to COVID-19. The enrollment to get insurance has been extended again until August 15th. Rosalind Goodwin with the South Carolina Hospital Association says there are even more tax credits and a larger amount of people actually qualify. She was with us a couple of months ago to tell us about the first extension, and she's going to come back on the show soon to discuss Obamacare enrollment updates. And there are plenty of them, she says. All South Carolinians ages 16 and over can now get the COVID vaccine. Beginning today, you can register or find a location near you at scdhec.gov/vaccinator. Or for more information, you can call the number on the screen. Now, the Pfizer vaccine is the only one of the three currently approved and it's authorized for 16 and 17-year-olds. So check the type of vaccine being administered when you register at your preferred location. Speaking of which, a new vaccination location has opened up at Benedict College. The CVS-run clinic is open Monday through Saturday from 10 a.m. until 4:30 p.m. at the school's Community Learning Center building located on Two Notch Road. Again, you can see that information on the screen, and that information will be scrolling at the bottom of the screen throughout the show. Finally, South Carolina Governor Henry McMaster has launched a $6 million partnership to help bridge the internet gap in South Carolina. University of South Carolina, Benedict, and Apple will collaborate to create 8 community computer labs located at the 2 schools and Columbia's Bull Street district. Now the facilities are open to the public, which in addition to internet access will offer workforce training and educational programs beginning in about 90 days. DHEC has your most up-to-date information on times, dates, and location for COVID tests, flu shots, and also the COVID vaccine. Visit scdhec.gov for more information. You can also go to gogettested.com. If you still need a COVID test, you can get appointments, locations, and results in 48 hours. The DHEC Care Line is still up and running. It gives you information on testing, vaccines, organizing a COVID screening at your event or neighborhood, and transportation to get a COVID test. Now, speaking of transportation, if you live in Richland or Clarendon counties, paramedics there are offering in-person COVID screenings. Call 911 for more information. COVID vaccines are being held throughout South Carolina. Just a few I want to mention to you. Lexington Medical Center is offering COVID vaccinations. Also, if you are a vet, the VA is handling all COVID vaccinations, and this includes anyone, any age that is a vet. Kroger pharmacies are also offering the COVID vaccine. Check the screen for details on that. And CVS is offering several vaccination locations, not only in the CVS pharmacies, but also at the Target locations that have CVS. And that's not only statewide, but nationwide too. Now, if you are or you know a senior that is having some challenges getting set up to get vaccinated, well, they can contact Get Set Up. They can actually help walk you through the vaccination process. Now, they're not going to register for you, but they certainly will give you all the help you need to make sure you get your COVID vaccination appointment. Free rides to the Get Your Vaccination courtesy of the Comet bus system. Don't miss your shot. You can get a free ride via the Comet to get your COVID vaccination. Now, there is a drive-through vaccine event going on right now in Fairfield County. They are there in Fairfield County until 3 o'clock today. So if you live in Fairfield County and you need your vaccination, please make sure you stop by that location in Fairfield County. Now, the NAACP Housing Assistance Program is still open for landlords, mortgage companies, and tenants. So if you need more information, please get that information so you can get those resources that are available. The South Carolina Bar Association and SC Legal Services are also offering their toll-free number and website for rental and mortgage help. And if you live in Richland County, the Richland County Rental Assistance Program will open April 5th. That's right, this week. Visit richlandcountysc.gov for more information so that you can get your information together when the website and phone number opens up. You'll have all your ducks in order. Now, speaking of which, Thursday, tomorrow, right here on Coping with COVID, we're going to talk to attorney Edie Lane. She's going to give us all of the information about homeowner and renter rights. That's right. Your rights as a homeowner, your right as a renter, and also everything you need as far as the new CARE Act, the new stimulus package. There are some concessions in there for homeowners and renters. She's going to tell us all of that and more. That's coming up tomorrow on Coping with COVID. If you still need some help with online help with working and with going to school, Rashonda Pratt's YouTube channel is up and running. Go over to her YouTube channel and hit subscribe. And the City of Columbia 6-month payment plan for water bills and payment assistance up to 75% off. If you're having some challenges paying your water bill and you live in the City of Columbia, make sure you check that out. It's Women's History Month, the last day of Women's History Month, and the WNBA has a beautiful T-shirt that they are giving, that they're selling to proceeds benefit the National Council of Negro Women. So go to the website and check out the WNBA's Women of Color T-shirt. And finally, the Black Lives Matter Scholarship Fund is up and running. They have $3 million to help African Americans. Particularly, they're looking for those who are transgender, ex-offenders, and people that are providing childcare. If you need a $1,000 grant, you can see the information on the screen and apply for the Black Lives Matter Scholarship Fund. Now, all of this information will be scrolling at the bottom of the screen, in addition to additional vaccination locations that's scrolling at the bottom of the screen throughout the show. So don't forget, you can get that information throughout the show right here on Coping with COVID. You are watching Wellness Wednesday, brought to you by DHEC, In It Together SC, and the Diabetes Advisory Council. I'm Tre Tailor, and we're actually streaming live on the In It Together Facebook page. Please go over there, hit like, hit follow, not only so that you can see Coping with COVID, but they've got such great information there about a diabetes prevention program and all types of resources for you. So check out the In It Together page on Facebook for more information. They also have a website, the In It Together website. Now, we're also streaming live on the TaylorMade production page and the Tre Tailor page. That's the home of Coping with COVID. Again, please go over there, hit like, hit follow, hit share, and do the same on the YouTube channel, because we're streaming live on the TaylorMade YouTube channel also. Please hit the subscribe button. We also have a presence on IG and on Twitter. Now, listen, I want to remind you about this book. I have the book right here. I've got so many books here. It's the Dash for Good Health Southern Style Cookbook. If you asked for the book last week, Betty Fletcher, I see you on the show. Thank you so much for joining us. Your book is on the way. It is such a great book. This is such, and I'm not a cook, this is such an easy to read, easy to kind of go through book if you want to change your eating habits. All you have to do is put in the chat, I want to dash for good health. Someone will inbox you, get your mailing address, because we're going to mail this to you. Get your mailing address, and not only will you get this Dash for Good Health Southern Style Cookbook, it's a sensible eating plan to promote good health. You'll also get a Coping with COVID face mask. Don't forget to go ahead and do that. Put in the chat, I want to dash for good health. I'm Tre Tailor, and Wellness Wednesday and In It Together SC and the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday here on Coping with COVID. And listen, COVID, among other things, has definitely shown the light on what many Black and Brown people already knew about discrimination, racial disparity, and just the reality that in America, we as Black and Brown folk are treated differently based on the color of our skin. Dr. Damon Tweety penned a fascinating book about 5 years ago that not only confirms this practice is real for patients, but those who also pursue a career in medicine. Black Man in a White Coat, a doctor's memoir of how Black patients and doctors must navigate the complex system of race in medicine. He's featured at the 19th annual Chronic Annual Disease Prevention Symposium in June. It's sponsored by DHEC, and Khristian Curry is here to tell us all about it. Khristian, thank you so much for joining us on Coping with COVID.
Thank you, Tre.
Absolutely. So listen, tell us about the 19th Annual Chronic Disease Prevention Symposium. That's a mouthful, but I know it's going to be it's going to be an amazing event. Tell us about it.
Yeah, so we've been hosting the symposium for 19 years now. Usually we host it at the beach in Myrtle Beach, but this year it'll be virtually held June 3rd through the 5th. And the theme, as you mentioned earlier, is going to really speak to this opportunity that we have with COVID to explore the intersection of race and health. So our theme is the color of health, and we have a really good lineup of speakers to speak to that topic.
Right.
Yeah.
So it's the color of health. So tell us about the speakers. We know Dr. Damon Tweety, who we were just talking about with Black Man in a White Coat. He is going to be the featured speaker. Tell us why it was important to have Dr. Tweety be one of the speakers.
Yeah, so I think one of the strategies, that one of the things that we've been talking about is this idea of connectedness. So we wanted to feature a reading that really spoke to what people are experiencing, spoke to the topics that we're talking about right now in the arena of public health, but also something that can connect us, even though we're going to be apart. So we're going to share the moment of reading this book, and then we're so grateful to have Dr. Tweety so that we can talk about it together virtually.
All right. So in addition to that, what other topics and sessions are there for people to participate in?
Yeah, there are a wide range of topics and sessions. We're going to have a speaker, Dr. Tess Stevens from the Medical University of South Carolina, is going to be talking about resilience and what that means, especially amongst the healthcare team. We have Dr. Robert Fulilove from Columbia University's Mailman School of Public Health. He's going to be talking about race and health and what the implications of COVID has had on that. We have community health workers presenting. We have people talking about behavior change, lifestyle change, physical activity programs, a wide range. And most of them do present from the scope and lens of equity and disparities. So we have a really wide range that appeals to a wide audience.
All right. So when is this? This is in June. Tell us when it is.
June 3rd through the 5th. It's half days on the 3rd and the 5th, and the 4th is a full day. So people can it has enough flexibility where you can kind of pick and choose, and we've spaced the sessions out so that people can attend the sessions that they're most interested in.
All right. If people want more information, there the link is actually in the chat. You can go to scchronicdiseasesymposium.org. Is there a cost for this, Khristian?
There is a cost. So the costs are listed on the website, and it depends on your discipline and what kind of attendee you are, because we are offering continuing education credits for a few different professions.
Oh, that's cool. So who is this for?
I would say that it's for anybody who has a stake or an interest in chronic disease prevention. But in the past, we've had physicians, nurses, pharmacists, dentists, social workers, community health workers, health educators. We have a wide range of attendees.
Mm-hmm. Would you think that it's something good for the general public too?
I think so. I think the general public would have a lot to gain from it. And I think it's important for the general public to attend because a lot of the interventions in the program that we're talking about, like the general public is the intended audience and the intended recipient of these programs. So
Right.
their voice is so important in that. Yes.
Right. Well, like you said, in addition to the general public, I would think this would be an excellent opportunity in light of what you were saying, the climate of our country right now, a great opportunity for professional development for those,
Yes.
as you said, not only in the medical field, but have a stake in a chronic disease. So people can register. The link is in the chat, SC Chronic Disease Symposium.org. They can click the link and get not only more information about the symposium, but they can also register, correct?
Yes. Yes.
All right. It's the 19th annual Chronic Disease Prevention Symposium. It's June 3rd through the 5th. It's virtual. Maybe next year we can get to the beach, girl.
We hope so. We hope
Yeah.
so.
Yeah. But again, check out the link for more information. And Khristian, thank you so much for joining us today on Coping with COVID. We appreciate it. And thank you for all of your work to help put together this seminar.
Thanks so much, Trey. Appreciate it.
Absolutely. Well, we just heard from Khristian Curry, the 19th Annual Chronic Disease Prevention Symposium, June 3rd through 5th. Dr. Damon Tweety, author of the best-selling book, Black Man in a White Coat, will be the featured speaker. Oprah says, this is fascinating, heartbreaking memoir. Tweety documents his experience as an African-American doctor in a medical system that can be just as sick as its patients. It's a New York Times best-selling. Dr. Tweety is with us today. Thank you so much for joining us today, Dr. Tweety.
Yeah, thanks for having me. It's a pleasure.
Absolutely. So tell me, why did you write this book?
I think two things, real reasons. The first was, you watch shows about doctors and you read books about doctors and there's lots about in the public sort of sphere, 20 years ago about doctors, but so little bit discussed the idea of what it was like for the Black patients that these doctors are largely serving. You think about so many the places where a lot of stories are set: New York, D.C., Boston, Atlanta, large Black populations, but there's very little discussion about what is it like for that Black patient. It was almost as if they were kind of invisible in some way. Yet in schools you would learn during school that being that Black people sort of have all these different higher risk for health conditions, but there was like no context put to it. And so I really wanted to write a story that sort of explored a lot of that. So that's one piece. The second piece is really just the story about what it's like for people who are training in the field, what it's like for a young man to go into the medical profession, and sort of what are the challenges that an aspiring Black person faces as you're trying to sort of go through the system, but also trying to take care of this larger population of people who are getting short shrift. So it's really kind of a story that tells both of those elements.
And why did you think that was important to tell?
I feel like it's just something. I feel like, it's a story that's long overdue, right? And so it's something that you really needed to someone to give voice to, right? And so I'm just one person in one perspective, but I wanted to sort of, and so nowadays there's a lot more out there. But when I was first starting to write it, it was striking because there was a lot of resistance. I mean, I think that it speaks to this larger challenge. So when I first started after I finished my training around the late to 2007 or so, I started trying to publish some short materials in journals and things. And what they told me were things like, well, we only publish stuff that's important to academic medicine leaders. So but this is really important. I mean, it's like half the patients in your hospital are Black and having all these sort of, these challenges. And then they would say things like, well, we kind of know about this anyway, but it's not really, it was almost as if they were saying they knew about the problem, but it wasn't really important. And so I just kind of wanted to put a space to give voice to that, to amplify the voices of people who otherwise, we're getting kind of, left out, right, and ignored and sort of just trampled over in all sorts of ways.
I want to say hi to Renee Nelson. Thank you, Renee, so much for watching. I want to remind everybody to post and share this information out. Listen, everyone has had an experience with the medical profession. And Dr. Damon Tweety is here. And we're going to get into it a little bit more about what it is behind the scenes of being in the medical profession and what we need to know as Black and brown people to help us navigate the medical profession even better. He is the author of Black Man in a White Coat. It's the New York Times best-selling book. He's going to be featured at a virtual symposium sponsored by DHEC, the 19th Annual Chronic Disease Prevention Symposium. So, Dr. Tweety, you actually went to school to pursue medicine on a scholarship to kind of help African Americans in that, kind of navigate that field. Is that correct? Is that correct?
Yeah, so I went to Duke for medical school. So I'm from Maryland. I went to University of Maryland, and then so I came to Duke for medical school. And at the time, Duke it's got like so many other places, and these schools have a lot of history to reckon with, right? And so throughout it wasn't until the mid 1960s that Duke even admitted Black students at all, and even then it was very, very few. And it wasn't until like the late 80s, early 90s that a woman named Brenda Armstrong, who's really well known in sort of the medical education circles, she came to Duke and she took over the admissions office and really helped. Her mission in life was really to get more Black people into the space of medicine and medical school. And so Duke began offering scholarships for minority, underrepresented minorities who had sort of for so long been ignored, right?
Right.
And so, for me, I think about that. My dad, when he was coming along when he was my age, Duke wasn't even accepting. They would refuse you. So it's not like this is ancient history, right? And so,
right.
In some ways, this was like I think this was part of Duke's effort to begin to try and address some of the longer standing issues that they had. So yes, they offered a scholarship, and that was a big reason for me coming there.
Right. I want to say hi to Cynthia Watson. She says, wow, this is unfortunate. Another reason why there are disparities in healthcare. Thank you, Cynthia, so much for watching and for your comments. Want to remind everybody to continue to post and share. Listen, want to also remind you that if you register for the symposium by April 9th, you actually get a copy of Dr. Tweety's book, Black Man in a White Coat. So don't forget to register for the conference, and that information is in the chat. So you go to Duke, all bright-eyed and bushy-tailed, ready to be a doctor when you grow up. And how was the response versus what you thought it would be?
Yeah, that's a great question because, I was one of those, I had a little bit of naivety about me. So I grew up in an all Black neighborhood. And so I knew about some of the realities of life, but I was attracted to medicine partly by the idea that it was kind of, it'd be almost post-racial. It sounds terrible to even think that now. But this idea, like it was rooted in science and it was objective and it was concrete and I wanted to become a surgeon when I first got to medical school. And so when I got to med school, though, it was like you got hit over the head with this race thing, but in ways that were really problematic. So like every time in a class lecture, they would always tell you that this disease was worse in Black people or Black people did worse, but they never give you any explanation as to what that was about, why it was. And you were left to just sort of think about, it was almost as if they were implying that it's just like, genetic and destiny, and this is just what it's going to be, but no idea about like what all the factors were and how to address them, right? So there was that piece, but then there was the personal piece of like obstacles I faced individually. And so there's a story. My book starts off with the scene as me as a first-year medical student. I go into a lecture hall. The professor confronts me at the lecture hall and basically asks me, why am I here in the classroom? Are you here to sort of do the maintenance work in the class? And if you're not here for that, then, why are you here, right? So there's that real, it was that generational, the ugliness, right? So my story's peppered.
And this is what year, Dr. Tweety?
1996.
96.
Oh, yeah. I'm old, but I'm not that old.
Not 1896.
Exactly. Yeah. So my stories are peppered with those kinds of experiences. Yeah. And, those kind of, patients who didn't necessarily want to see you because of, this and that, they want to see a Black doctor. All sorts of experiences like that. So I'd speak to that. How do you navigate that as a young person who's aspiring to sort of work within the system, but also I try to really give voice to the patients as well. So it's all those things are sort of happening simultaneously.
Right. Well, a couple of things I want to ask. First, I want to ask, I thought it was interesting that you said you were presented as a student with, okay, this is diabetes. Black folks always get it. This is stroke. Oh, Black folks always get it. And it kind of sounds to me, because there was no explanation as to why that kind of fed into maybe the thought that we were inferior because we are diseased.
Right. It sort of conditions people to believe that, right? Conditions people to believe that it's almost like a brainwashing, for lack of a better word. And it sort of, first of all, it ignores how diverse our group of people are as a group of Black folks, right? It's a big swath, Black people, X, Y, Z. And then it also conditions people to sort of think, well, if it's either genetic or it's like you're doing something wrong. And so it's like, it's either the blame game or it's like, this is some sort of like, and so it ignores so many other factors. And one of them, which is really important, is what is the role of the healthcare system in perpetuating the problems themselves? Like what practices, like taking an inward look at what are we doing that's making this worse? And so, there was none of that back then.
Yeah, well, I want to piggyback back on that, but then you said something also. So now you have to learn how to navigate this blatant racism and separatism, I'm sure, because how many other Black students were there in school at the time, other than
So,
you?
well, so my class was actually perhaps I think the first one where they again I mentioned the scholarship, right? So they were really trying to make a change. So I might, for me it was about 12 students, and that was double from the previous year, and even more than that from the years before that, because there was this effort to really begin to increase the enrollment. So whenever you make changes like that, there's always going to be backlash, and there's always going to be people who
Yeah.
question whether we need to do this or not. And so I was at that point in time in history where those things were happening, where you have the new people who are trying to push for change, and then you have the old guard who wants to keep things the way they've always been. And so that's where some of the tension came up.
We're talking to Dr. Damon Tweety. He is the author of the best-selling book, Black Man in a White Coat. It is a doctor's reflections on race and medicine. He's going to be at the 19th annual Chronic Disease Symposium sponsored by DHEC June 3rd through the 5th. The link to register for the symposium is in the chat. If you register by April 9th, you get a copy of Dr. Tweety's book. So Dr. Tweety, how were you able to navigate that? I mean, you're young. You want to, you're just here to get the education so that you can, fulfill your dreams, hopes, wishes, desires. And here you are smacked with racism and again, separatism from the very people, from the very institute that you are seeking help from.
Yeah, I think the things that really help, and this is true for anybody kind of listening in, is I think the peers, right? So reaching out to the peers that are with you, and many of whom are sharing the same experiences, you can sort of draw strength from each other. There's that piece, but then there's also the older folks. I would talk to some of the older Black folks who had sort of been through it. They'd been through worse, and some of the stories they told me, it's just like man, just blow your mind. And it was a sense that drawing strength from them, like my journey is part of building on what they've accomplished, and
right.
And so I really took that to heart, and so I think that's what really kind of helped me get through some of the worst challenges, was that support from peers, but also reaching into the older generations who had been through these things as well.
Regina Williams says her daughter was about a year late in receiving medical assistance due to her being stereotyped. She says they're finally on the right track, but she could have been so much further along. I know, Dr. Tweety, coming up in the next segment, you are going to share with us what we should know and do to help us navigate the medical system as Black and brown people. But what do you say to Regina? A year, and we don't know the details, but.
Right. Yeah, I mean, there's unfortunately lots of stories like that. I mean, some of the challenges with medicine is really, we'll talk about this more later, trying to reckon with some of the problems of how we sort of propagate these issues. Like, I mean, we just make it worse because, we do this thing where if it's a Black person, we're going to lead it to a certain diagnosis, and we're going to have a certain treatment. And it's just so problematic. And so we're just only beginning to really face that and confront that. Because I guess an important point, your audience probably knows it for sure, but I think for a long time, people in the medical and scientific fields have sort of felt like they are immune from all this issues of racism and bias, because they feel like, we got these PhDs, we got these MDs, we've done all this schooling, we've been the top students in our class. We're not like that. We know there are people out there like that, but that's not us. And so there's that defensiveness that's sort of built up. And so, I mean, it's only beginning to be really broken down. And so it's that's happened for so long. So a story like that, yeah, I mean, there's so many stories like that. I mean, part of what got me into medicine was listening to my grandmother's story. And then, so, she was a Black woman, grew up in the South, and she talked about her experience with her doctor, and she had high blood pressure, and how the doctor felt like the doctor never listened to her. The sense of invisibility is something you hear a lot from Black folks when they go into the medical space. And so a lot of her experience inspired me to go into medicine, and I sort of carried that with me, as I go forward. But that story, yeah, I mean, so I hear you, what she's saying. And we'd like to, on the back end, we'll talk about, some of the strategies we can do to advocate for yourself.
Yeah, I definitely want to do that. Marcus Taylor says what, we all say. He says, this is why Black people don't go to doctors. He said, because of what we're saying, because people think they don't care. And we are here in the climate of COVID. And of course, we were the first getting COVID and the worst affected and the last ones. I mean, we're not even in the double digits amongst the people getting the vaccine that are getting the vaccine.
Yeah, it's tricky because there's certainly, he says it's common. Marcus is common about there's 2 points. The part about people not caring, there are certainly some people like that.
Yeah.
There are others who probably have good intentions, but just don't know how to put it together. And so there's a lot of pieces of trying to work with those folks. It's a lot of what I try and do. But yes, there's a great need for Black doctors in many specialties. I mean, I can tell you that what happens is across specialties, there's very few of us. So like, just to give you a vivid illustration of that, when I was in the clinic in my training, half the patients in our clinic were Black. I was the only Black doctor in that clinic out of like, more than a dozen doctors. And so many requests for like, can you see this person? Can you help this person? And so, that becomes a lot of weight on me as one person, right?
Right.
No, but it speaks to that larger problem about why we need, I think that the numbers now about 4 to 5% of the nationwide of doctors are Black. In some specialties, it's much lower, but 4 or 5% compared to like 15, 14% of the population. In North Carolina, we're 22% of the population. In South Carolina, I think it's even more, closer to 30% of the population is Black, and so few Black doctors. In some fields, it's a huge deal. Psychiatry, primary care, so many fields, it's a huge deal. And so this is a big part of what I want to do in advocacy, what I'm trying to push forward. So thanks, Marcus.
Thank you, Marcus, so much for your question. So Dr. Damon Tweety is author of the New York Times bestselling book, Black Man in a White Coat, A Doctor's Reflection on Race and Medicine. He's the featured speaker at the DHEC 19th Annual Chronic Disease Prevention Symposium, June 3rd through the 5th. The link is in the chat. You can go to the symposium website and find out all about the symposium. Register by the 9th of this month and get a copy of Dr. Tweety's book. When we come back, what are some of the big issues with race and medicine, and where are we now since he wrote this book over 5 years ago? That's coming up next on Wellness Wednesday from the South Carolina Diabetes Advisory Council and In It Together SC. And hey, don't forget also, you can get your free copy of the Dash for Good Health Southern Soul Cookbook and a Coping with COVID face mask. It's free to you, and we're going to send it to you. All you have to do is put in the chat, I want a Dash for Good Health, and we'll get it out to you. That and so much more coming up next on Coping with COVID. It's Wellness Wednesday. I'm Tre Tailor.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Right now, the COVID-19 vaccines are available to millions of Americans, and soon they will be available to everyone.
This vaccine means hope. It will protect you and those you love from this dangerous and deadly disease.
I want to go back to work, and I want to be able to move around.
To visit with Michelle's mom, to hug her and see her on her birthday.
You know what I'm really looking forward to is going to opening day in Texas Ranger Stadium with a full stadium.
We've lost enough people, and we've suffered enough damage.
In order to get rid of this pandemic, it's important for our fellow citizens to get vaccinated.
I'm getting vaccinated because we want this pandemic to end as soon as possible.
So we urge you to get vaccinated when it's available to you.
So roll up your sleeve and do your part.
This is our shot.
Now it's up to you.
Visit Davis Tax Service today, 803-419-1001.
Computers, they're a part of our everyday life. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821. Coping with COVID celebrates Women's History Month. Brianna Daniels is the first African-American woman to work in a NASCAR Cup Series pit crew and part of the first female duo to do pit crew work. The Virginia Beach native played point guard at Norfolk State University, where she was selected as one of 10 from around the world into NASCAR's Drive for Diversity program. The next year, Daniels was the first African-American woman to go over the wall in a national racing series and was recently honored at the 2020 NASCAR Drive for Diversity Award. Brianna Daniels, the first African-American woman to work in a pit crew in a national NASCAR race. Celebrating every woman. It's a Women's History Month celebration on Coping with COVID from Tailor Made Productions.
You're watching Wellness Wednesday on Coping with COVID, brought to you by In It Together SC and the South Carolina Diabetes Advisory Council. I'm Tre Tailor. Hey, don't forget to like, follow, post, and share on both the Tailor Made Production page and the In It Together page. We're streaming live on that page. And don't forget to ask about your Dash for Good Health Southern Style cookbook. We're going to hook you up with it. Hey, Barbara Ballard Belton says she wants a Dash for Good Health cookbook. We've got you, Barbara. Somebody's going to be inboxing you after the show to get your mailing address so that we can get it out to you. We're talking to Dr. Damon Tweety, author of the New York Times best-selling book, Black Man in a White Coat. It's a doctor's reflection on race and medicine. He's the featured speaker at the DHEC 19th Annual Chronic Disease Prevention Symposium, June 3rd through the 5th. He's been sharing some fascinating information with us today about race and medicine. Dr. Tweety, let me ask you this. Have you ever been discriminated against as a doctor, like a patient saying, I prefer not to be treated by him because he's African American?
Oh yeah, there's a story in the book. There's a whole chapter about that kind of experience. About what happens when something like that occurs. And so yeah, so that particular story I talk about was it was just to know, it was I'm a brand new doctor, brand new intern, and then you go down to the emergency room, and the nurse stops me before I get to the room where the patient is and says, "Be careful." He said he doesn't want any, N-word people, taking care of him. Yeah, exactly. So
he said this from at the grip.
Yeah, exactly. It was like that, right? So, yeah, I mean, so if you feel it was 2003, and I felt like it was 1963, right? In that moment in time. So yeah, those experiences that happened to me, and it's happened in different settings as well. I can tell you this has not stopped happening because, in more recent years, there's been a lot of attention, or a lot of other people have been writing about these experiences of, a person goes into the room, person says they don't want to see you. There's a lot of stories like that out there. It's very real, and it is certainly, unfortunately, still happening. In some instances, Black women may even get it worse because there's the factor of being a woman.
Now you're a woman and you're Black. Yeah.
Yes. So yeah, no, it's real. I've experienced it. My wife's experienced it. Yes, sir. Yes, ma'am.
What's some of the biggest issues about race and medicine?
So I think there's a couple things to think about. So there's the piece about the fact that this issue of class and socioeconomic status and how much those overlap with race, and the ways in which, just take health insurance, right? We have been having this sort of fake, ridiculous sort of discussion for so long about, is health insurance a right or is it a privilege? And, all the data shows that, how bad it is not to have health insurance or to have public health insurance versus private health insurance. Right. Disparities are just so powerful. There's so many stories that I write about that illustrate that, and Black people are disproportionately harmed by that. So, I'm hoping that with COVID, one of the challenges that will come out of this is that we'll get to a point in our society where health insurance will be something that, there'll be a baseline. This is what people are going to have, and then we can sort of figure out the politics of how we're going to do it. But right now, we're still in this other space. So that's one big part of it, right? Another big part of just race and medicine is, just what do people. Just this idea, like when someone sees you, like what are they seeing of you, right? And what does that doctor see, and how much is that doctor's experiences and his own bias, his or her own bias, basically literally coloring, for lack of a better word, what they're seeing when they see you, and there's just so many examples of what that happens with people. But in terms of how we're taught, I think in medical school, one of the big problems is there's this actually like this race-based sort of teaching kind of teaches people to be biased in all sorts of ways, to not view people as individuals, to view them as groups, and just to sort of come to these kind of crazy conclusions. Like there's a line of teaching in med school that there's certain diseases that only Black people get, and there's certain treatments that are supposed to be for Black people versus not Black people. But here's the problem with that, man. So you think about how the
That's
range.
Unbelievable.
It's crazy.
That's unbelievable.
No, it's crazy.
That is being taught
Well. Here's the thing. It's been taught for a long time, but that's changing a lot. That's
Right.
a lot. That's a lot of what's happening the last several years. Is to sort of take that on head on. But that was taught for a long time, and that's with a lot of the doctors. It's almost like there's a Brian Stevenson talks about how we've inhaled all this stuff. Is it smoke, and we don't realize what we've
Yeah.
inhaled. I think
Yeah.
that's true for medicine. So that point about even people who have good hearts have sort of inhaled some of this stuff for so long that it influences their thinking in ways that they are only beginning to understand. And so that's where we are in the moment now.
Barbara Belton says that she's been advocating for her dad. He's in the hospital for COVID while having stage 4 cancer since Saturday. She says she's had to advocate for him every day as far as the nurse administrator. Barbara, thank you so much for your question. Blessings to your dad and to you. Dr. Tweety, what should we know and what should we do? And how do we get our rights and advocate for ourselves as Black and brown people in the medical profession?
Yeah, that advocacy is really important, right? It's so important. So I think there's a couple things to think about. One is, educating yourself as much as you can, right? And I think, knowing yourself, like I love that cookbook you showed. I love that, it's any way you can sort of advocate for yourself and improve your own self. But I think there are a couple of things to think about. When you go see a doctor, it's always a good idea. You can't always do this, but kind of write out, like, what is your agenda? What do you want to get covered? What's important to you? A lot of times when we're sick or we're worried, it gets cloudy, we can't think straight. Put that thing out there at the very beginning of the visit before you get overwhelmed. Have someone with you if you can. If all possible, it's always good to have someone with you who can advocate for you, can be a little bit more detached from the situation and then more of an observer and an advocate. You need to the extent that you can have that is so important, because that also bears like a witness, for that person. Because otherwise, if it's just you and the doctor, things can be, well, he said this, he meant that. Having another person there can be so important to advocate for your family member or for yourself. So those are two things. I think the other thing is, thinking about when you're writing this list out and advocating for yourself, sharing that with your doctor, sharing what you tried, what your goals are, what you want, because I think it's a partnership. And if the doctor you're working with doesn't take that well, or is resistant or condescending or looking down on you, that might be a signal that, I know all of us don't have the same options as others, but that's the signal that there may be you may need to find a better person to match to your goals and interests, in which your needs are. I think all those things are extremely important.
We're talking to Dr. Damon Tweety. He is the author of the New York Times bestselling book, Black Man in a White Coat. It's a doctor's reflection on race and medicine. He's going to be featured at the DHEC Annual Chronic Disease Prevention Symposium. That's June 3rd through the 5th. If you want more information on the symposium, the link is in the chat. It's actually the SC Chronic Disease Symposium.org. Go ahead and register now. And if you do that by April 9th, you'll get a complimentary copy of Dr. Tweety's book. So it's been about a little over 5 years, right, Dr. Tweety, since you wrote this book. What's different? Has anything changed?
Yeah, so I think the world of medicine is beginning to sort of accept some of these problems that we've done in terms of education. You'll see a lot of schools now, they have coursework where they're beginning to teach students about, there's a term now, it's called social determinants of health. It talks about how, discrimination, where you live, basically about how all the sort of non-medical factors impact health in terms of like insurance, jobs, where you live, trauma, racism, things that have largely been ignored. And so in my generation, I had in med school, give me an example. We had 1 hour of discussion about race in 4 years of med school. 1 hour, 4 years, right? And that 1 hour is like everything that you want to say, put in that 1 hour, because you're not going to get a chance to say anymore, right? So let's think about how inadequate that is, right? So
yeah.
So a lot of schools now are having coursework where they have a whole course sort of devoted to these topics. Now, I don't think that's the ideal thing. I think ideally what we need to do is integrate that into every course, because I think it's so important. But this is where we're moving to. This is the start. And so you'll see a lot of those sorts of things now. There's been efforts to sort of, really try and improve medical student admissions and among Black students, mixed results. What's happened over the past year is really galvanized. I mean, the past year really just stepped it all up with COVID, and then everything happened with George Floyd and all the things that occurred from there. Med schools now are really finding themselves in some ways playing catch up, because there's like this idea now. A lot of it, what I will say is really important. A lot of this is being driven by the young generation. So what's happening is the people who are coming into the medical school world have a very different perspective, and so they are calling out what they see. So my generation was much more about, we're just kind of put our head down to try and just brush stuff off our shoulder and get ahead. But the younger generation is like, they're calling out and saying, no, we got to fix this. We got to change this. And that's making the faculty administration adjust to them in a lot of ways. So I'm really inspired by that, because I think that's what's really going to make us really get to the place where we need to go.
What about the younger students? It seems like this generation is more liberal, more open. As far as race is concerned, are younger people coming into the medical profession changing the medical profession any?
Yeah, absolutely. So I'll give you a tangible example of this. So like for a long time, this isn't the worst. So when if you were getting a lab test done and a doctor's measuring your kidney test, your function of your kidney, they would group you into categories. It would be black or non-black. And if you were black, there's a different way they would interpret the number than if you're non-black. I mean, again, think how ridiculous that is, right? You think about
that is ridiculous.
Because what does it mean? Because first of all, when you say someone's black, what does that actually mean, and who's making that determination?
Right.
And so a lot of times, a lot of clinics, what was happening is that people who were making that determination were just looking at someone and say, oh, well, this person, it looked black. Right. Right, exactly. But in some cases, the people were Middle Eastern. In some cases, so they're actually Asian. In other cases, the person was like, maybe biracial, and maybe. And so that's really important if you're thinking about trying to assess disease risk. And they're just picking everyone all black. So some of the students are like, well, what is that all about? Like, why are we doing this? And they question the professors. And the professor's like, I don't really know. This is just kind of what I've been taught. It's not even like people are just sort of accepting, because if you don't have to face
status quo.
Yeah, status quo. You're like, okay, like I don't even know. Let me go look. And then he went back and looked. It's like, man, this doesn't even make any sense why we're doing this. And so a lot of places now are rethinking that, because there were actual real world clinical potential harm based on that. Because if you're assuming this person is black and we're interpreting data differently, it was actually potentially impacting how soon someone could get the kind of care they needed for their problem in terms of how you manage their diabetes. I mean, so it's like, it is, when people say systematic problems, it is systematic, because that individual doctor could be a well-meaning middle-aged white doctor who's in this system and is just doing the status quo stuff. But the system is setting things up for problems, and so until you address that, you're not really addressing the bigger problem. So I mean, that's just one small example. Yeah. We could talk about many other examples. That's just one to give you a little taste of it.
And while he may not, this particular doctor that you're talking about in general may not mean any harm, he's just doing what he's been taught.
Right. Exactly. Right. And which he may not mean harm, but he could actually be doing harm.
Doing harm.
Exactly.
Right.
Exactly.
Yeah.
So that's exactly.
Yeah, Barbara Belton says, wow. I said wow too, Barbara, in my head. I mean, this goes to Marcus Taylor's point. He says 1 year he was told he had high blood pressure. They tried to give him meds. He didn't take it. They gave him a blood pressure machine. He says, long story short, they found out that the machine wasn't calibrated right. So now he has no medical issues. But it sounds like to me, just generally speaking, he was black. He had to have high blood pressure. Didn't even check to see if the machine was off.
Yeah, I'll give you. There's other stories about that with other things. We could have a lot of talk about that. But I'll give you another example about the blood pressure, because it's a really important one. So, but there's also been some studies back to this race-based thing, saying that certain drugs are supposed to be better for black patients than white patients. And if you're black, you should take this medicine versus that.
I've heard that.
A lot of generalization. There are some people that's true, but there are others who are not, because remember, race is so non-specific, right? When you're saying black, it could mean you could be from this part of Africa, you could be from that part, you could be from Caribbean, you could have this much European. So we got to really break all that down if we're really trying to get to what the person needs. But what happens is that there's some black people who I haven't seen who have been doing well on medicine that was not thought to be good for a black person. Right. Got to a new doctor. That doctor thought they were following guidelines, right? Because this is what the guidelines told. They're just doing what they're told. And then they switch that person to this other medicine that's supposed to be good for black people. And then the person doesn't do well and they have problems, right? And so because this race is so imprecise. When we're thinking about from a it has very little utility from a biological standpoint, but it's very important socially, right? But very not important biologically, and that's where medicine has struggled. And I think that's the kind of the point which I really want people to understand. And medicine's beginning to really grapple with that and understand the social thing so much more so than a biological genetic thing, and that's where we really need to focus.
Yeah, that's good. Thank you, Marcus. I wanted to piggyback on what you said, because I remember a couple of years ago, there was something going over the godforsaken internet about.
There's a lot of that.
Stop. Don't get me started on that. But about and it was people saying, I heard that you should not take this. And I think it was a blood pressure medicine.
Mm-hmm.
You should not take this blood pressure medicine because it's bad for Black. I mean, I just remember so much of that Black folks were telling other Black folks, don't take this medicine, don't take this medicine. And of course, according to you, it was based on something they were told that could have been true, could have been false, could have been anything.
A lot of it's partially true. And so for any individual person, those things are not good guidelines to go. I'm sorry, I mean to cut you off though.
No. Dr. Damon Tweety is joining us. Black Man in a White Coat is his New York Times best-selling book. It's a doctor's reflection on race and medicine. Hey, he's going to be speaking. He's going to be the main speaker of the DHEC 19th Annual Chronic Disease Prevention Symposium. I want to get Michelle James a question in here. She says, raising awareness about these issues is so critical, especially among our elderly living in rural America, since many of them tend to take their word as gospel and don't know or are afraid to ask questions. Thank you, Michelle.
Yeah, that being afraid to ask questions is a big piece, and it's piece of sort of not speaking out what you feel or what your concern is. You have to think that it's your body. You've been living in that body in that space for all this your whole life. You have to tell that story. You are the one that the best know that. It's very hard for me to just come in and despite all the education I have, to come in 10 minutes and I'm going to be able to figure everything out. That may look like great on TV, but in reality, a lot of it is like you really have to be able to advocate for yourself. I know in some cases, older people can be more difficult. That's why I think it's so important to have family and other people be actively involved, or other community organizations like this to really advocate for people who have difficulty advocating for themselves, because it takes it can take a village, for lack of a better phrase.
Yeah, Michelle, thank you so much for your questions. Barbara Belton says she's often asked if she's diabetic or have high or HBP.
High blood pressure.
High blood pressure. Yeah, thank you.
Right.
Simply for being Black and overweight.
Yeah, well, it's that's kind of how you're taught though. So this goes back to how so there's correlation with those things, right? But it's also, this is how you're taught, and so this is so you're taught to make these. It's actually the way you even test. You get tests, and the tests are even designed. Some people are arguing that the test further the stereotypes because you're tested and you're rewarded on making these kinds of associations. So again, it's
assumptions.
So it's a system thing, and this is why the whole medical education system has to sort of is just rethinking itself from the very beginning. Because otherwise, we can't turn out doctors who are going to be better if we don't do better with the whole system itself.
Is there a way to find a good doctor, a culturally sensitive doctor? Are there sites maybe like blackdoctors.com.org or something like that Black and brown people should go to find the best doctors for them?
Yeah, so now, I think there's a few thoughts. So I don't want to just scare people from going to the doctor altogether.
Right.
We don't want to convey that message because we've been down that road. We've had a lot of stories of people being afraid altogether, and then things go wrong. So I don't want to tell that, but I think there's plenty of white doctors. If you establish a good relationship, you can test and see if that person is really going to be, like I said, do some of the things that I suggested. If the person doesn't respond well, that may be a signal that this is not going to work out. As far as Black physicians, there's definitely blackdoctor.org. Yes, there's one. There's a couple for there's like blacktherapist.org. There's several that are actually good. The psychology, for those interested in the therapy, the Psychology Today has some listing of Black providers in different parts of the country, and you have to register for that. So yes, I would say that's a good start. Sometimes you may find if you're in a academic medical, if you're in a sort of a world where there's a medical school, you can look on the sites, and sometimes there will be people who are interested in certain health disparities, community health. You will find certain people who are interested in that, and these are people, often the kind of people you may want to sort of find. So you can sort of seek them out. There's certain ways of sort of searching for these folks who are very interested in this kind of work, and those are probably some of the people who are most likely to do right by you.
Regina has one more question before we let you go, Dr. Tweety, that I want to mention. Regina is talking about that medicine that I mentioned to you. She says, why do doctors keep prescribing the high blood pressure medicine that causes Black folks' lips to swell if it's known that this is a reaction? Regina, that's what I was asking, what I was saying. I remember hearing that it was I don't even remember what the medicine was, but it was just, don't take this because it's Black folks have a bad reaction. But you're saying that may not necessarily be so for all Black folks. That's the problem, right?
Yeah, that's part of the problem. But I do think it's important. She thinks that's why it's a sophisticated kind of knowledge that we need to have, right? Because it's what she's describing is something called angioedema, and it is something that can happen with a certain group of blood pressure medicines. But no,
is it only for Black folks?
No. That's the answer is no. So, so there are plenty of white folks who can have that same reaction as
Right.
well. And so, yeah, so that's why it's tricky. So I wouldn't, but that's the kind of thing though. If you have a good doctor, you can bring up and you say, well, tell me, I've heard this. What do you think about this? And a good doctor is either going to be able to give you a good answer or going to be able to look that up and not make a treatment plan until they address your concern. So I guess
Right.
that's a sign of whether you have a good doctor or not. Bring up that concern. Can they address it? Even if they don't answer in the moment, will they look it up and get back to you in a way that they'll do right by you? And so that's one of the signs to look for when you're trying to find a good doctor.
Right. This is Dr. Damon. Go ahead. What were we going to say?
Because they don't listen to you and blow you off. That's one of those signs. That's one of those warning signs.
Yeah. Dr. Damon Tweety is the author of the New York Times best-selling book, Black Man in a White Coat, Doctor's Reflection on Race and Medicine. He is going to be the speaker, one of the speakers at the 19th Annual Chronic Health Symposium, June 3rd through the 5th with DHEC. And go to that website right now if you get a chance and register for the symposium, and you will get a complimentary copy of Dr. Tweety's book, Black Man in a White Coat. Tell us about some of the work you're doing now, Dr. Tweety, at Duke and Durham at the VA.
Yeah, so I'm working both locations. So yeah, so I'm a psychiatrist in actual training now, and so at the VA, I work in the a lot of veterans are, probably 40% are African American that we see, maybe even more than that. And I'm in the Durham VA. I come from a military family on both sides, and so I work as a psychiatrist, but I work in settings like in primary care where I'm trying to reach people when they go see their family doctor, and I'm there to sort of help consult and help them get the best care they can in that setting. So that's one thing I do. As far as at Duke, I teach a lot of classes for medical students, all the things we talked about. I'm trying to be part of that change and trying to educate folks for the next generation. I continue to also speak a lot on race and medicine in all sorts of forms. I'm also writing quite a bit about that as well. I'm interested in really, because there's the whole realm of mental health, which we really didn't tackle, in race and all the sorts of layers in that, which I'm really trying to explore and give voice to as well. So those are sort of all the things that kind of keep me busy these days.
That is great. Well, listen, thank you again so much for joining us. This has been a fascinating conversation, and I can't wait to get you back here to talk about it more. If you want to hear more from Dr. Tweety, please register for the 19th Annual Chronic Disease Prevention Symposium, June 3rd through the 5th. And go to scchronicdiseasesymposium.org for more information. If you register by April 9th, you'll get a complimentary copy of Black Man in a White Coat, Dr. Tweety's New York Times best-selling book. And it's going to be great, what you were talking about. Yeah, Regina said she thought that's what I was talking about. Yeah, that's exactly what I was talking about. Dr. Tweety, thank you again so much for joining us and for the work that you're doing. I mean, it is, like I said, it's fascinating work, and it's, I just believe when we know a thing, when the universe, God, whatever people believe, put us in positions, we should use that for the good. Yes. And you are certainly doing that. And I just appreciate all that you're doing. Thank you so much. Can't wait to see you in the symposium, and wait to get you back here on Coping with COVID.
Yeah, and everything you're doing is great. That other book sounds great. That book about the DASH diet, soul food. Yes, give that some love too, because that's huge. That's been a big part of me and my own health. So I really want to give that a real plug.
Oh yeah, because that's the thing with us. That is the big thing with us.
Yes. So thank you so much. Yeah, you're doing great stuff. So keep it up.
Thank you. Thank you so much, Dr. Tweety. I appreciate you. Thank you. Betty Fisher says, thank you so much. Thank you, Betty, so much for watching Coping with COVID. Hey, don't forget, as Dr. Tweety said, get this book. It's the Dash for Good Health Southern Style book. How do you get it, you ask? All you have to do is post in the chat, I want a dash for good health. Somebody's going to inbox you and get your mailing address, and we'll mail that out to you with a Coping with COVID face mask. Listen, if you have a story or initiative that can help someone cope with COVID, please go to the Tailor Made production page, inbox me, and we would love to have you featured on Coping with COVID. If you have a product or service that can help someone cope with COVID, please email copingwithtreTailor@gmail.com. The information is scrolling at the bottom of the screen, and we'll be glad to make you a proud sponsor of Coping with COVID, just like In It Together SC and the South Carolina Diabetes Advisory Council. Tomorrow, Attorney Edie Lane is going to talk to us about your rights as a homeowner and renter, and what you need to know about the new stimulus package, the American Rescue Plan Act. There is some verbiage in there about renters and homeowners. That's tomorrow. Attorney Edie Lane. Join us tomorrow at 2:00 on Coping with COVID. As always, I leave you with a spiritual reading. I've been reading 100 Days of Believing Bigger with Marshawn Daniels Evans. I'm also fasting and praying for some things in my life. Hey, Richard Miner, thank you so much. He wants a Dash for Good Health cookbook. Thank you so much. This is the faithfulness of God. This says, for doers and achievers, it can be difficult to be still and wait to know God's plan and how it's going to unfold. It's natural for us to want to know what's ahead and how it's going to all come together and when. Maybe you're the type who's not afraid to do her part. Give you a goal and you'll make it happen. But what if your part is letting go? Sure, it's easier said than done, but this season is more about surrender than anything else. And surrender is a complicated balance when we're trying to help our families build a dream and change lives in the process. Here's the good news, though. The verse above, he who calls you is faithful will surely do it. It's 1 Thessalonians. That verse gives us a stress alleviating promise. God will surely do it. Not you, not me, but he. There are some breakthroughs that can only transpire with the move of God's hand. We can't force it. We can only flow in it. That's your 100 Days of Believing Bigger by Marshawn Evans Daniels. I'm Tre Tailor. Thank you so much for joining us in It Together SC and the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday here on Coping with COVID. Until the next time, I wish you peace, abundant blessings. Take care, stay safe, get your vaccine, and don't forget to wear your mask still over your nose and under your chin. See you tomorrow.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.